Welcome to all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return, as I have learned a lot, earned a lot. Now it's a time to return a lot to the word. The topic of today is osteoarthritis. As one can see, this is the disease which can affect the knees of the person, the fingers of the person, and the ankle of the person, and any joint of the body can be affected, but mostly it is affecting the knee and the fingers. So the introduction of the lecture is that the other names of the osteoarthritis are degenerative arthritis or degenerative joint disease. It is a type of degenerative joint disease which results from breakdown of the joint cartilage and the underlying bone. Frequency, it affects about 1 in 7 adults or 3.3% of the population, and it is the fourth leading cause of the disability in the world. Arthritis means inflammation of joints. Osteoarthritis is called wear and tear arthritis. There is breakdown of the cartilage in joints and it involves any joint in the body. Symptoms of the osteoarthritis are joint pain, stiffness, joint swelling, decreased range of the motion. Initially, the symptoms occur following the exercise, but later these become constant and just these are present at rest also. Joints of one side of the body are often more affected than those on the other side of the body. It can affect work and normal daily activities. Usual onset is over years and years. It just do happen. Causes are connective tissue disease, previous joint injury, abnormal joint or limb development or inherited factors are also blamed. Risk factors are overweight, legs of the different lengths, job with lot of joint stress. And diagnostic methods are based on the symptoms spotted by the other tests. Treatment is exercise, efforts to decrease joint stress, sport groups, pain medication, and sometimes the joint replacement as a last resort. In a healthy joint, ends of the bone are covered by the smooth cartilage, also protected by the joint capsule, lined with a synovial membrane that produces synovial fluid, which helps in the movement and the less restriction of the ends of the joint. The capsule and the fluid protects the cartilage. In osteoarthritis, cartilage becomes worn away, spurs grow out from the edges of the bone, and all this lead to the osteoarthritis picture. So here one can see the normal articular cartilage and the normal meniscus of the normal joint, and there is the normal joint space. But here one can see the bone spurs that comes out from the bone and the cartilage which is normal here that is lost, and the joint space is narrowing, but here the joint space is normal. So all these features cause the problem of osteoarthritis. Now, epidemiology, osteoarthritis, most common arthritis affecting 3.3% of the world population. I have already told you it is more common as the people do go for the aging. At 60 years, 10% of the male and 80% of the females are affected. Hip osteoarthritis affects about 0.85% of the population. At 65 years of age, 80% people have radiographic evidence of the osteoarthritis, but only 60% of those will have the symptom. In Middle East and North Africa, prevalence of the hip osteoarthritis increased 3 times than in the other nations. So the other animals, osteoarthritis has been reported in several animals, including marine animals and even some fossils. Also reported in the fossils of the large carnivorous dinosaurs, that is Allosaurus fragilis. Now, etymology. Osteoarthritis is derived from the prefix osteo, ancient Greek means bone, combined with arthritis, that is joint associated with inflammation. The itis of the osteoarthritis is considered sometimes misleading by some authorities as there is no inflammation. So some clinicians refer to this condition as osteoarthrosis to signify no inflammation. Now, there are certain risk factors which have been seen in osteoarthritis. Out of the several factors responsible, number one is heredity. Some people have an inherited defect in one of the genes responsible for making the cartilage, so the normal cartilage is not formed and the defective cartilage is formed. This causes defective cartilage and more rapid deterioration of the joints. People born with the joint abnormalities, abnormality of the spine like scoliosis, are more prone to develop osteoarthritis. The next risk factor is obesity. Increased risk for osteoarthritis of the weight-bearing joint, knee, hip, and spine causes osteoarthritis, and obesity causes cartilage to break down faster than normal. Suppose if your body have the engine of 1300 cc and you put the body on that of 1800 cc, and there will be definitely the problem with the engine which is not of that strength to combat the 1800 cc body. The risk factor continuing obesity. So maintaining ideal weight or losing excess weight will definitely help to prevent or decrease the rate of the progression of the osteoarthritis. Third factor is injury. It causes damage to the cartilage and development of the osteoarthritis is there. Athletes with knee-related injuries are at higher risk of developing osteoarthritis, and people with severe back injury are also prone to develop osteoarthritis of spine. People with a broken bone near a joint are also prone to develop osteoarthritis in that particular joint. Now, risk factors for osteoarthritis are elderly age, and especially in the women because of the menopause. Then there is obesity, overweight, then diabetes, and bone deformity, and the blood iron increased, that is hemochromatosis, and then stress on the joint due to the sports or the jobs, prolonged standing jobs, and then knee injuries and the family history of the osteoarthritis. As I have told you, the inheritance factor, women more likely than men, that is again because of the menopausal problem and osteoporosis. Now, fourth risk factor is joint overuse. Increased risk of developing osteoarthritis as people with the jobs which require repeated bending of the knee, they develop osteoarthritis of the knee. Then certain other diseases as the fifth risk factor, that is the people with rheumatoid arthritis develop osteoarthritis as well. Then certain rare conditions like iron overload or excess growth hormone have more chances of developing osteoarthritis. Certain cartilage damaging diseases, malalignment, race, geographic, and ethnicity variation also contribute as the risk factor. Now, the sites which are mostly involved are in weight bearing joints of the hips, knees, spine, or the lower back, also affects the hands, the fingers, thumb, neck, and large toe. So one can see the spine, the hip bone, and then the hands and the knees, which are mostly involved by osteoarthritis. Position of the husband is like a split AC. No matter how loud he is, but he is outside. But inside the house, he is designed to remain silent, cool, and controlled by the remote, as one do see in the inner unit of the split AC. Now, what are the causes of osteoarthritis? The three main causes are blamed. Number one, occupational. Number two, primary. And number three are secondary. First, the occupational problem. There is increased risk of knee and hip osteoarthritis who work like lifting, walk at work, climbing tasks at work, like climbing the stairs or the ladders as a part of their job. Hip osteoarthritis in those who work in bent or twisted position, knee osteoarthritis in those who work in a kneeling or squatting position. Heavy lifting plus kneeling or squatting posture and work standing up are the reason of occupational problem. Women and men have similar occupational risks for osteoarthritis. Now, the other cause is primary or the idiopathic. There is history of the previous joint injury plus obesity and genetic factors, especially in the knees, are blamed. Greater prevalence of the disease among the siblings and identical twins, that is also the genetic factors. Certain inherited conditions born with the defective cartilage or with the malformed joints, change in the sex hormone levels have role as it is more in the female because of the menopausal and the hormonal problem. That is more in postmenopausal women than among the men of the same age because there is no hormonal change as it is seen in the woman. Racial difference like African American and Caucasians, but it is still not proven yet, so it is said to be a controversial cause. No identifiable cause. It is of three subtypes. The primary or idiopathic is of three subtypes collectively called inflammatory osteoarthritis. So here there are three subtypes. Number one of the primary and idiopathic. Number one, nodal or localized. It affects one or the two joints only. The second type is generalized. It is present in three or more joints or the multiple joints are involved. Appendicular joints like knees, hip, and small joints of the hands are involved, and in axial, skeleton, cervical, and lumbar spine is involved. The third type of the primary idiopathic is erosive. It involves hand joints in women and it is less common and more aggressive form. Flare causes erythema, swelling, and severe pain. Distal interphalangeal joints of the hand with erosion, osteophytes, and ankylosis seen on the x-rays of these kind of patients. Now the third cause is secondary cause. It is seen in the following problems, but the pathology is same as for the primary osteoarthritis. Diabetes doubles the risk of having the joint replacement due to osteoarthritis, means they people are more prone to have the osteoarthritis as compared to the non-diabetic. Diabetics have joint replacement at a younger age than non-diabetics. Mechanical problem of the joint, congenital or acquired, like acetabular dysplasia of the hip, is also blamed. Calcium deposit inside the joint, pseudogout, is also the culprit. Continuing the causes, secondary causes, injury to the joint or the ligaments like ACL, anterior cruciate ligament, due to an accident or orthopedic operation, congenital disorders of the joints like L-capto, L-captonuria, Ehlers-Danlos syndrome, hemochromatosis, Wilson disease, Marfan syndrome, avascular necrosis, and the joint infection. Inflammatory diseases like Perthes disease, Lyme disease, costochondritis, gout, and rheumatoid arthritis. In gout, uric acid crystals cause cartilage to degenerate at a faster pace and faster race. So, about the causes, occupational and other, the primary causes are aging, mechanical stress, and heredity. And the secondary causes are the obesity, acute trauma, surgery, congenital abnormalities, gout, rheumatoid arthritis, or the other inflammatory condition, diabetes, or other hormone disorders. So these are the main causes, primary or secondary. Now, coming to the pathophysiology of osteoarthritis. Osteoarthritis is degenerative joint disease by damage to the articular cartilage, bone, and synovium. Here, cartilage is lost, bone becomes affected, pain restrict the exercise, so there is muscle loss also occur. Water content of the healthy cartilage is balanced by two forces. One is compressive force that drive the water out, and hydrostatic and osmotic pressure draws the water in the cartilage. With aging, water content of the cartilage increases, so the cartilage degenerates and there is decrease in proteoglycan. Inflammation of the synovium and the joint capsules as breakdown products from the cartilage fall into the synovial space, and the joint cells react in the form of the inflammation because of the foreign particles considered by the joint, which do fall as a part of the cartilage into the joint space. Now, new bone outgrowth called spurs or the osteophyte do form on the margin of the joints. Subchondral bone volume increases and becomes less mineralized, that is called hypomineralization. Ligaments within the joint become thickened and fibrotic. Menisci are damaged and wear away. Pain is due to the thickened synovium and to the subchondral bone lien, as the cartilage is not able to protect the bone. Inflammation in the synovium influences the chondrocyte activity, and cartilage covers ends of the bone, normally reduces the friction in joints and work as a shock absorber. And as one can see, the normal knee and osteoarthritis knee, the normal cartilage, and here one can see the cartilage is broken down, and bone and the cartilage fragments do fall into the joint cavity and causing the inflammation. And here one can see the eroded cartilage and the joint fluid with low concentration of hyaluronate. So there is cause the friction between the two ends of the bone, and here also the spurs or the osteophyte that do rise from the bone and that is also causing the pain. And here one can see the normal bone and synovial membrane and the joint fluid with the high concentration, and here there is the less concentration of the hyaluronate, and that causes the friction and the damage to the joint, as one can see. Now, in osteoarthritis, cartilage becomes stiff and lose its elasticity, prone to the damage which is normally not in normal cases. Tendons and the ligaments stretch, which cause the pain. There is more destructive than the productive process occurring in the joint. Destructive cytokines like IL-1, TNF alpha, and other causes the enzymatic degradation of the cartilage matrix, and that is not counted by the inhibitor which do occurs in the normal joint. The main enzyme involved are metalloproteinase, MMPs, the growth factors like TGF beta, IFG, BMP, NGF, and the others repair the tissue damage occurred by these enzymes. And here one can see in the early stage of the disease, there is degeneration of the cartilage and there is reactive new bone formation. And the late stage of the disease, cartilage particles do fall in the joint cavity and there is loss of cartilage and there is bone hypertrophy. So the space between the two bones becomes less. Now coming to the sign and symptoms of osteoarthritis. There is joint pain, joint swelling and stiffness. There is decreased range of motion because of the pain, and if the back is affected, weakness or the numbness of the arms and the legs has been reported. Symptoms progress slowly in years and interfere with the work and normal daily activities of the patients. Any joint, but mostly involved are fingers, thumb, knee, hip joint, neck, and the back. Here only joints, not the internal organs, are affected, as one do see in case of rheumatoid arthritis. If small joints of the fingers, buttoning a shirt can become difficult and the patient will complain this, and that will help in the diagnosis. So here are the symptoms of the osteoarthritis. There is pain, grating sensation, stiffness, swelling of the joint, and tenderness, and the bone spurs which have been seen. Now, osteoarthritis of the knees and the hips lead to the limp, and this limping of the patient, that is also helpful in the diagnosis. Pain worsened by the prolonged activity and relieved by the rest. Stiffness is common in the morning, so that is called morning stiffness, and it lasts less than 30 minutes after daily activities, and it lasts more than 30 minutes in case of rheumatoid arthritis. May return after periods of inactivity. The stiffness may return after period of inactivity. There is crackling noise called crepitus in shoulder and the knee joint. When the joint is moved, patient complain joint locking and the joint instability. Pain increase in cold temperature, high humidity, or the drop in barometric pressure. Sometimes the joint fusion of the knee also occurs. In smaller joints like fingers, hard bony enlargement called Haberden's nodes seen on the distal interphalangeal joints or Bouchard's nodes on the proximal interphalangeal joints may form. These are not painful, but they limit movement of the fingers. Osteoarthritis of the toes causes sometimes the formation of bunions, making them red or swollen. So, Haberden or Bouchard nodes, here one can see the Haberden nodes and here one can see the Bouchard nodes. So, to remember, Haberden that is seen HD. Haberden nodes distal interphalangeal joint, that is HD. Bouchard nodes, as one can see, that is proximal interphalangeal joint. So we can just remember BP as an abbreviation to remember Bouchard problem. So Haberden high above, as one can see, that is distal interphalangeal joint, and Bouchard below, that is PIP, proximal interphalangeal joint. So this is the way of remembering Haberden versus the Bouchard node. And sometime also one can see among the phalanx bones and the metatarsal there is a bunion which just give the bad shape to the foot. Now, the classification of osteoarthritis. There is number of classification systems are used for gradation of the osteoarthritis, but here I am just placing, that is number one, Womack scale, that consider pain, stiffness, and functional limitation. Number two is Kalgren-Lares grading scale for osteoarthritis of the knee, uses only projectional radiography features. And the third classification is Tony's classification for osteoarthritis of the hip joint, that use only the projectional radiographic features.